Well, it's Wednesday, everyone, so time for a little wisdom. I want to talk a little bit about thyroid today, as we've had quite a few patients who have received some information from their pharmacies about their particular thyroid. There is one out there, NP thyroid, that has had some recall. So I thought it'd be okay to talk a little bit about thyroid and about this recall. As you know, thyroid is an important hormone in the body, and for many of us, particularly as we age and as we live in these stressful times, such as this particularly, we know that the hormones that are major in our body, particularly cortisol, has influence over our thyroid and can downregulate that. Thyroid's kind of important for a lot of things in our body. It helps regulate our temperature, our metabolism, even cerebral function. It has important information for our body to increase our energy and helps regulate body temperature. It helps break down fat. It's very good for protecting our cardiovascular system in that it can help burn off a lot of the LDL cholesterol and lower some of our cholesterol numbers, so that can be helpful. So it has some protective benefit there. It improves cerebral metabolism as well as cognitive impairment. And we see for many people it's very helpful for helping diminish dryness in our hair and hair loss, especially in as we age, and then also thinning nails as well. So thyroid's kind of an important hormone, although it's a minor hormone. The two major hormones, insulin and cortisol, do take precedence over that. But thyroid still maintains a high degree of importance in our body, and so we look at it as far as replacement goes. Now, for those of you that have been in, and we've talked recently particularly about thyroid, you know that there's two main molecules in the body, the T4, which is 2-tyrosine with 4-iodine on it, and then T3, which is 2-tyrosine and 3-iodine on it. And it's that T3 that is the active form. And it's important that we have plenty of T3 around so that we can have all the benefits of the thyroid hormone that we just discussed. So as we look at this, T3 is being the active form. Many physicians will just prescribe T4 and allow the body to do the conversion. But for most patients, having a little bit of T3 in their formulation does make a difference. And so we generally prescribe a combination of T3 and T4 in our hormone program. Now, recently, the NP thyroid has been recalled, and I will tell you a little bit about that. So the FDA allows pharmaceutical companies to provide products with a 10% variation in their potency. So for instance, if you have a 1 milligram product, the FDA allows it to go anywhere from 0.9 to 1.1 milligrams, which is the allowable part. So what was found out with this most recent batch of NP thyroid is that it was over 100%. It went from not 110 but 115, so it was a little bit higher than allowed by the FDA, so there was a recall. Now, what I've told my patients is that for the most part, most of you are going to do fine with that tiny little bit of extra T3 in there. But if you begin to have palpitations, or you're feeling anxious or nervous, or having any chest pains, excessive sweating, or just feel uncomfortable in your skin, we want to hear from you. We would want to be able to make that change for you. But the rest of you are probably going to do fine and not notice a thing about what you've experienced with your current doses if you've gotten a letter about the recall. But please do let us know about that. And I want to just reassure you that this is not going to be a harmful thing. It's not because there's something tainted in there. It's just that the percentage of T3 in there exceeds what the FDA considers allowable. So I hope that answers most of your questions, but please feel free to call us and let us know if you have any other questions. As far as what's going on out in the world, we do know that the virus is penetrating a little bit more. We're seeing more cases each and every day. This is not unpredictable. I think as we have opened up, we're definitely going to see more, but in order to achieve any type of herd immunity, we will see more and more cases. The good news on that front, however, is that the hospitals, particularly in this area that I'm able to keep an eye on, the beds and ICU beds that are available still remains under 70. Well, we're not full, and we have at least 30% availability. The ventilators definitely remain somewhere between 32 and 36%, so that has not gone up any further, which is good news, just so that we're not overburdening the medical system, and that's really the most important thing. We're also seeing much more improvement in terms of treatment. Recently, dexamethasone has sort of risen to the top. This is a steroid. And initially, I guess that we thought the steroids were going to have a negative effect, but we're seeing more and more positive reports and studies that are coming out. So I do think that from a medical standpoint, the treatments have improved and have definitely reduced morbidity and mortality. Again, please remember to keep that vitamin D level up for you and your loved ones. The information on vitamin D continues to be very positive as far as some of the current literature is concerned. So I think that that's quite an important thing. And of course, I tell everyone to keep extra vitamin C and zinc around. Some of the other things that we've talked about in the past, quercetin, NAC, and N-acetylcysteine remain as boosters and immune supporters. So I think the most important thing is to continue to boost the immune system. In the next few weeks, I was just going to share a few things as I'm listening to a book called Lifespan. I think I've mentioned it before, but I'm going to try to share a few more things as we move along the path on Wednesdays about just anti-aging and aging to the best ability that we can, trying to continue to keep that, compress the illness phase of life to our end of life so that we can be helpful and productive in our world. So all the best to you all. Happy Wednesday. Have a great day.